Hey, AFib, or atrial fibrillation, is a condition that affects a large number of the population, causing fatigue, shortness of breath, heart palpitations, but could eventually lead to more serious issues like stroke. Today, Dr. Nora Thormeier, Medical Director of the Structural Heart Program at Mercy Health, is here to talk to us about a safe alternative to those who suffer from AFib. It's called WATCHMAN. Good morning, doctor. Thanks for being here.
Good morning. Thank you very much for having me on.
Appreciate you being here. Atrial fibrillation. Could you give us a description of AFib and how prevalent it is before we jump into this WATCHMAN?
Sure. Yeah. Atrial fibrillation is a very prevalent disease in what we deal with in cardiology. And it's basically when the two top chambers of the heart are fibrillating, or how we describe it to patients, are wiggling like a bag of worms, and there's no coordination to the two top chambers communicate with the bottom chambers, and it leads to symptoms like you discussed, palpitations, sometimes even fatigue is a big one we deal with. But the most important thing that AFib leads to and can cause are strokes, which can be life-changing or even cause death. So
absolutely,
that's what we're really worried about.
Now, is this the same as a heart arrhythmia?
Yep. Atrial fibrillation is one of the probably the most common cardiac arrhythmia that we deal with in patients.
Okay. Perfect. Now, WATCHMAN, let's learn about this. What exactly is WATCHMAN?
The WATCHMAN is a very exciting device. It's a left atrial appendage occlusion device. And what we do is we take this device and we implant it into a structure in the heart called the left atrial appendage. And what it does is it blocks blood flow from going into the appendage and therefore prevents clots forming there. And this is very important because more than 90% of clots that lead to stroke in patients with AFib are formed in this left atrial appendage. So the WATCHMAN device is designed to prevent that from happening.
That's an amazing statistic you just mentioned, that we were able to discern 90% of strokes from people who with AFib happen in that location.
Well, patients with AFib, yeah, the clots that are formed that lead to stroke in patients with AFib are more than 90% are formed in that appendage.
Wow. So knowing exactly where to put this device, it's an amazing thing to just consider, that you're actually going in right into the heart and putting a device there. So the benefits, what does it do? It basically prevents clotting?
Yeah, it's a very safe, minimally invasive, one-time procedure that provides lifelong protection from stroke, the same as patients that would take blood-thinning medications like warfarin, but it gets them off their blood-thinning medications.
We're actually getting some great video now of how the actual, is almost like a stent, keeping that open. So who might qualify for WATCHMAN? Where can people learn more and see if they qualify for that procedure?
Yeah, the patients that qualify for this procedure are patients who have non-valvular atrial fibrillation, who have other medical comorbidities that put them at an increased risk of having stroke, but cannot take blood-thinning medications or should not take blood-thinning medications because they've had a history of bleeding or other issues. The other patients that qualify are patients that have some occupational or lifestyle hazards that they should not be taking blood-thinning medications. And also, warfarin is a medication with a lot of side effects, but also has a lot of drug interactions and can interact with other medications that people take. So by doing this procedure, it helps get patients off their blood-thinning medications like warfarin.
Well, as always, Mercy Health on the cutting edge. Thank you so much for the time, doctor. If you want to learn more information about WATCHMAN, or if that is you, as you can see the stat right there, those with AF, 5 times more likely to suffer a stroke than those with a regular heartbeat. You want to find out more information, 616-685-7800, or just visit mercyhealth.com. We'll be right back.